My name is Ahmed Mohamed Hassan, and I will be presenting treatment satisfaction and medication adherence among patients with epilepsy at Daoud Charity Clinic, 2021. Epilepsy is the most common neurological disorder, and it is defined as the tendency to have unprovoked seizures. A seizure is the occurrence of certain signs and symptoms due to abnormal, excessive, or synchronous neuronal activity in the brain. An epileptic seizure can present in different forms that are categorized into three groups: focal seizures, generalized seizures, and unknown onset. The chronic nature of epilepsy requires long-term management with a therapeutic goal to attain seizure control. Management of epilepsy with anti-epileptic drug is usually effective and in the majority of patients yields good seizure control. However, a considerable percentage of epileptic patients has been reported to fail to obtain seizure control. One of the possible causes is poor adherence to medication, which is a common problem in medical practice, especially in the case of chronic diseases like epilepsy. As noted in different studies, treatment satisfaction predicts continuous pharmaceutical treatment, correct medication use, and compliance with medication regimen. Therefore, the aim of this study is to measure medication adherence and its relationship to treatment satisfaction, duration of illness, and epilepsy control, and to determine the causes of non-adherence in Sudanese patients with epilepsy. This study was designed as a cross-sectional study and was conducted at Daoud Charity Clinic. Epileptic patients attending Daoud Charity Clinic and fulfilling our inclusion criteria were recruited to our study. The inclusion criteria included adult patients with an age range of 18 to 70, diagnosed with epilepsy for at least 1 year, using at least one anti-epileptic drug for at least 6 months with no change in anti-epileptic drug in these last 6 months. Total coverage of patients with epilepsy attending the Daoud Charity Clinic and fulfilling the inclusion criteria during a period of 8 weeks was conducted. Data was collected through an interview using a questionnaire which consisted of 3 sections: demographic and clinical data, treatment satisfaction questionnaire for medication, help on medication adherence scale. Differences in means among the groups were tested using t-test, and associations between continuous variables were tested using Pearson correlation. All statistical analysis was conducted using SPSS version 24. Our results showed that out of the 72 patients included in the study, 43% were males and 57% were females. The mean age was 31 plus or minus 11. The mean Hillborn medication adherence scale score was 34 plus or minus 2.1, which indicates high adherence. Adherence was not statistically significantly correlated with duration of illness. There was no significant difference in mean Hillborn medication adherence scale score between patients with well and poorly controlled epilepsy. The most common reported cause for missing the medication more than once was short supply, followed by expensive price of the drugs, inconvenient timing of the drugs, too many drugs, and negative beliefs about the drugs. Mean treatment satisfaction scores regarding 4 domains of effectiveness, side effects, convenience, and global satisfaction were 84, 92, 83, and 83 respectively. There was a significant correlation between adherence and the convenience domain, but not the other domains. In our study, the mean Hillborn medication adherence scale score was 34 plus or minus 2.1, which indicates a high level of adherence. Most of the similar studies used Morris-Kime medication adherence scale and reported high rates of non-adherence. The difference in results could be due to the use of different scales. Our study reported a significant association between adherence and satisfaction, especially in the convenience domain, but not the other domains. Other studies reported a significant association with the effectiveness domain. Our study is the first study, up to our knowledge, to assess adherence and satisfaction in Sudan, and one of the few in the African continent. However, the small size of our study makes the results less likely to be representative and generalized. To conclude, our sample in our sample, medication adherence and treatment satisfaction was found to be high in patients with epilepsy. Treatment satisfaction in regard to convenience was significantly correlated to medication adherence. Thank you.